Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Amy Louw. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, in this episode, Amy Louw from Equine-Librium College in South Africa joins Renee to discuss insights from her soon-to-be published research on the relationship between veterinarians and veterinary physiotherapists in South Africa. And this is following on the official registration of the vet physio profession in our country. Now, while the study focuses on South Africa, the findings offer valuable globally relevant insights into the challenges and opportunities within our industry. Now, one of the biggest hurdles our profession faces is building strong referral relationships and improving how veterinary professionals perceive physiotherapy. It has long been speculated that formal regulation of veterinary physiotherapy could enhance referral networks and professional credibility, but does the research support this? So Amy's findings reveal encouraging trends that could shape the future of our industry and help us foster better collaboration with veterinary teams. We also dive into which veterinary professionals are most likely to refer, how we can improve communication with vets, and strategies for strengthening these crucial professional connections. Now, to support your efforts in enhancing these referral relationships, you can have a look at our private label rights digital products. You can rebrand these educational resources within your clinic's branding and provide them to vets in your area so they can pass them on to clients with pets needing rehabilitation. This not only adds value to their practice, but also increases your visibility as the go-to expert. So you can go to www.onlinepethealth.com/digital products to find out more. A quick word from our sponsor before we dive in. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your pets age gracefully, our brands Walking Pets, Help 'em Up, Response Systems, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts offer effective, innovative, and proven solutions. So you can sign up today to receive a one-time special gift for all the podcast listeners with your next order. And you can go to pawprosper.com/OPH to do this. All right, let's hear from Amy.
Hi, Amy. Thank you so much for joining me today.
Hi, Ane. How are you?
I'm very well, thank you. I'm very well. How are you?
Good, thank you.
Awesome. So, Amy, you've done some research in the last few years that looks at the promulgation process in South Africa, and more specifically, how that's impacted the relationship with veterinary physiotherapists and veterinarians. So I'd love to get into that with you. Can you tell us a little bit about what the research is about, and then what inspired you to do that research?
Yeah, sure. So I wanted to get a feeling of the working environment between vets and vet physios in the country post-registration of the standalone profession, as it's different to the rest of the world. And the promulgation occurred at the end of 2017, so it's relatively new. And I just wanted to figure out if this had impacted or at least had an effect on vets' perception of the profession as a whole, and potentially their willingness to work with us directly from a referrals point of view. So more just to gauge the challenges that our graduates in particular, but everyone working in the field, may face when trying to establish these referral communication setups with vets in the area.
Okay, so your research is really based on South Africa and our current situation here, but it really does give us a clue for all of us in the industry, no matter where we are in the world, because that referral relationship or that multidisciplinary team relationship is relevant wherever we are. And it is one of the biggest challenges that we face is, are we actually getting referrals? Do vets understand what we're doing? Why are they not referring to us? There are so many questions around that we at Onlinepethealth get all the time. So I'm really excited about this because it gives us a clue. One of the things we like to say is that, our profession and our industry can move forward if we can be better regulated. And so this starts to answer that question, right? If we're better regulated, is there an improvement? Are there more referrals? What happens? Okay. So let's just...
Sorry, also to touch on just the regulation, I think it also sets in motion or more defines the profession and defines the skill set and potentially the scope of practice and where they fit into a multidisciplinary team. Because I agree with you, the multidisciplinary team is so essential to your complete management of a patient. We all have our part to play in our animal patients. But if our scope of practice and our skill set is clearly defined, then vets and other practitioners know who and when they can refer to.
Yeah, that makes it much easier, right? It's not guesswork or something that's based on personal experience with one practitioner. They can blanket us and group us together and say, you have, just like we would with veterinarians, we would say, you know what you're doing. I can send this patient to you regardless of whether or not I personally know you. I could refer a patient to you because you're a vet. So I think that's really awesome. Maybe before we go into the rest, we should just clarify what that means in South Africa if we talk about a promulgated profession, and then how that is similar or different to other parts of the world. So did you say 2017? Was that when we promulgated?
Yes, end of 2017, yeah.
Okay, and essentially all that means is that we have a direct route into the profession. You don't have to be a veterinarian or a human physiotherapist first. You can come out of school and then go qualify as a veterinary physiotherapist by going to a registered and recognized institution that teaches that. And it means that once you're qualified, you're regulated by our South African Veterinary Council, so not by an association or the physiotherapy groups, but by the animal, council or in our country. So I think that's pretty huge and very valuable because that same council is regulating all the professionals that work within animal healthcare. So that's fantastic. Did I miss anything there? That basically outlines it.
Yeah, that basically outlines it. I think we're listed now as a paraveterinary profession under the South African Vet Council, which is what I think makes our situation unique in the context of the world.
Okay, so can you briefly outline for us how you did this research?
Sure. So it was a mixed methods approach. So I gathered both quantitative and qualitative data. The qualitative data was done through online Zoom interviews with individual practitioners. So in both fields, so both veterinarians and both veterinary physiotherapists that were currently based in South Africa and working in the field. So obviously they had to be registered with the South African Vet Council. And then the quantitative data was derived from questionnaires that were sent out using the association portals. So for the vet physios, it was sent through our South African Animal Physical Rehab Association. And then for the vets, it was sent through the South African Veterinary Association. And the requirements for both of those associations are registration with SAVAC or the South African Vet Council. It was 2 questionnaires, one specifically aimed at the vets, gauging an idea of just getting a basic background of their demographics and what type of practice they were based in and how many years of experience they'd had, also which area of the country they were based in. and then moving on more to their relationship or their perception or understanding of physiotherapy as a profession, but also physiotherapy skill sets and as a whole, and whether they work with physiotherapists or refer to physiotherapists, just trying to gauge their their professional relationship with the profession. And then a similar setup from a questionnaire point of view that was sent to the vet physios, more looking into how many vet referrals do they get, what are their challenges when trying to get vet referrals, or what have their challenges been when starting out in the profession, and just looking more at how their perception of their working environment and how easy it's been to integrate into a multidisciplinary team.
I love that you had both those viewpoints and then could bring them together. I think that's really useful instead of just looking at just the veterinarians or just the veterinary physiotherapists. So that's really cool. So in terms of that perception that you started with, what was the vet's perception of veterinary physiotherapists and their place within that care team?
So overall, it was a very positive perception. I was pleasantly surprised, I guess, by the positive feedback that I received. I mean, I understand that a lot of these vets could have an interest in the rehab field, or have been exposed to it. So we do take that into mind. But when asked about their relationship with physios, there were comments saying it's an integral part of animal health care, or we've seen the difference that it makes with our patients when we refer. And from the numbers point of view, 83% of our vets agreed that veterinary physiotherapy should be considered an integral part of animal care, which I think is really fantastic. Yeah.
That's really fantastic. I love that. So I always have this question of, I could be chatting with a vet and they would seem to have a really positive perception of what I could do as a physio, but then I never get referrals from them, right? So is that what you saw, or how did those statistics relate to actually how often they're physically referring or working on patients with veterinary physiotherapists?
Yeah, so the numbers were lower. So 65% of the vets from the survey said that they regularly refer to vet physios. This is higher than previous research done in South Africa, though. 2016, Sean Johnson did research, and it was I think it was about a 43% referral rate. And then in 2008, there was a small study done where it was less than an 8% referral rate. So it's definitely growing, which is fantastic. But then when the vet physios were asked about referrals, their numbers were a bit lower. So just under 50% received regular vet referrals. So that is still indicating that there's definitely room for growth. And definitely we can do more to try and get more vet referrals if possible. Yes.
Okay, I think that's really interesting, hey, that there's that perception, but that has to come first. There has to be a shift in perception, and their understanding, and then there can be a shift. Yeah, the action takes a little bit longer, but those numbers as they've changed is really positive. And even, what did you say, 60-something%? That's really good. Yeah.
It's good. Yeah. It would be great to be higher, but it's really good for now. And I think it is going to get higher. And I think we also have to take into consideration the third party involved, which is the client. So the vet might recommend or suggest or say you need to go to physio, but at the end of the day, it's the client's decision if they're going to take the animal to physio. And a lot of it is cost factors involved, time, just ability of the client. So some vets actually commented that we suggest it, but at the end of the day, we don't follow up if the client does take the animal to physio.
Okay, that's useful. And the other side of the coin, the same thing, right? A lot of owners are going directly to physios, and not going through through that veterinary recommendation or referral first. which is part of why there's a difference when we're looking at the veterinary physiotherapists' report of how many referrals they're getting versus word of mouth or direct, people coming directly to them. So yeah, that's interesting.
And I think that opens up a door of maybe trying to get a better relationship with vets, is that if you do have a patient that comes to you that hasn't seen a vet, obviously, especially if there's red flags associated or really concerning signs when you do your evaluation, but even if there's not, to send a report to their main vet or to the vet that they see, and to say, we're seeing this patient for X, Y, and Z, or we just like to keep you updated on how he's going, and not really always expecting a reply, but just opening up that communication channel so that you've done your part as the vet physio. Because in the rules from SAVIC, we have to work in collaboration with a veterinarian. They are considered the primary caregiver in our animals care team. So I think that if we start opening up more of those channels, that relationship is going to come. They get exposed to what we can help with. They get exposed to our skill set, and they get exposed to good communication and follow-up and feedback from our profession.
Yeah, I think it's a very good opportunity for us to open that door and to create a relationship. So I think it's essential. Yeah, not just legally, but for us to grow our businesses, to grow our client base. So I love that. So did you see any factors that influenced referrals? So were there certain groups of veterinarians that would refer more? What were those factors? Is there anything there that we can influence and impact to get more referrals?
So there were significant relationships found between vets that had specialization or postgraduate specialization. I didn't go into the details regarding the specialization, but those that had done postgraduate studies were significantly more likely to refer, or there was an association between those that had more specialization and higher referral rates. So we're not saying that it's causative, but there's definitely a correlation there. And that could be due to a number of factors. They potentially are seeing more patients that are relevant to physio management, and as well as their education and knowledge regarding patient management from a physio or rehabilitation side of things is more. Because from an undergraduate point of view, I don't think it is explored a lot. They've got so much to cover in their undergraduate studies that I think the rehabilitation part is very much just touched on.
Yeah, I think
so that was one.
Yeah. I think that part is important for us to realize, because we love to say that they don't, there should be more about what physio, like the part that physio can play in their studies, but there's so much to cover. I don't think that's really
unbelievable.
Is it necessarily, Sarah? Yes, but potentially the way that we envision it isn't realistic and isn't the best way. So we need to get creative about that one. I think that's interesting. Yeah.
Yeah. I think exposure maybe is more relevant than actually teaching. So, once they're on clinical blocks, maybe more exposure to vet physios would help it. Yeah, I mean,
we love that. Yes. So where are they going on clinical blocks, and what are those relationships and communication between those practices and the physios that they work with? Are they getting exposure to that? I think that's a good idea. Yeah.
Yeah. And then there was obviously a link between practice type. So your small animal clinics, your specialist clinics, there was an association between higher referral rates than when we compared the mixed practices and even our mobile practices, predominantly, which would be equine based. So yeah, it was interesting to unpack that. But most of the places that had a clinic located from a small animal practice point of view, the access to the physio to go and connect with the vets or connect with the practice was there. So to establish that initial communication, it's easier to do so if you've got a location where you can leave information and where you can pop in and meet people, and versus if you're trying to get hold of a mobile practitioner, it's very, very difficult to do. I mean, vets are exceptionally busy. Time is money as well.
Okay.
Yeah. Yeah.
So was that the vets that are mobile or the physios that are mobile?
So that was particularly in from the vet questionnaire, but the veterinary physiotherapy questionnaire also, it mirrored those results. So our vet physios that are mobile based, there was a significant link significant association between lower referral rates or receiving lower direct referrals from vets than if they were based in a clinic in an actual location. So it came from both questionnaires, and it also actually came from the qualitative data as well when speaking to the vets and the vet physios about the challenges. The equine vets and the vet physios that were mobile did say how difficult it was to establish communication channels with the other person, because they're always on the move. They're always busy. It's really difficult to keep that communication flowing and get hold of each other.
Yeah, it's tricky, right? Because you want to be professional. So like, it's so easy if you can just walk into a room and stand in front of a person and talk to them.
100%.
We
Yeah.
have to email them. And I often find, if we're raising concerns, or something's not fitting right with the patient, right? And how do you broach that with someone that you can't look them in the eyes and say, I'm worried about this. I don't know what's going on. I'd love to send them back to you. This is what I'm thinking. This is where my mind is going. I just need us to know, right? So here you go. If you write that in an email, it sounds weird, right? It just doesn't work right. And to send a voice note or picking up the phone often doesn't work for that exact reason. They're busy, they're seeing patients. So you miss the call and you don't get to connect with them. Yeah, so it is a tricky one. Do you have any recommendations for how we can kind of broach that gap? So many vet physios are mobile. Like we almost all start off that way.
Yeah.
It would be years before we establish ourselves in one location. How could we start to, have you got any ideas for that?
Yeah, just looking at the data and the interaction between the different practitioners, most people say perseverance. So, figure out who works in your area, who the vets are, where their specialities lie or their interests lie. And then just persevere to try and meet with them, or to at least leave your card, your name, in multiple formats. So from an email point of view, it's really important. But also if you can meet the reception staff, if there's reception staff involved, and become a familiar face in the practice. Also knowing which yards they go and service, and maybe timing it so that you're around when the vet is there. Especially in the early phases, you're going to probably spend a little bit more time marketing than you are actually treating patients, or trying to get patients. So FaceTime is really important, that they see your logo, that they see your brand, and that it's almost just repetition of your services, your skills, and your practice. And then once you've gained access to a vet in whatever shape or form, if they reply to you on email, that's fantastic. If you manage to chat to them face to face at a yard or in the practice, make it short, but try and make it memorable, because they don't have time. And I think patient feedback is really important, and it needs to be written. So an email is always the best way to do it. And then once it's established, many of the vets said that they actually like a WhatsApp, because they can respond to it when they can. It's also written, so it's in text. just from a legality point of view, but they don't willingly give out their cell phone number, understandably so. So that's obviously something that needs to be built up once you've established that relationship.
Okay, I love that. I love that. So really try and get that face to face as much as you can. And it's not just going to be one time, it's going to be repetition. I love that you mentioned creating that relationship with the reception staff because that's
Yes.
your gateway in.
100% the gatekeepers.
Yeah.
Yeah.
And
Yeah, which they need to be.
yeah, they need to, that's their job.
Yeah.
Exactly.
Yeah.
Meg actually speaks about this in one of her podcasts or early trainings because she said that, you know, go introduce yourself and then ask about the reception staff and then in your little notebook, write down their names, write down the things about them. Do they have kids? Do they have dogs?
Yeah.
What do they like? Whatever it is about them so that you can just remember that and hold on to that information and then refer back to your notebook when you go back there and you ask them about those things. And
Yeah.
I mean, I don't remember any of that stuff. I don't even remember it about my clients, never mind the reception staff and the vet, right? So have a space where you can write that down so you really become good at connecting and then creating that relationship of trust with the gatekeepers. Yeah. And
Definitely.
in the early days, like just as much face-to-face time as you can get. So I agree with you. If you can time your visits, even if you don't have a patient at the yard, but you know the vet's going to be there, go. Be there, be present, chat with them and make it memorable. I love that. Thank you. Yeah, good advice.
I also think that your patients also speak for you. So, or your clients, should I say. So if they have a positive experience with you or they found that you've made a difference, they generally feed it back to their vets. So I think we mustn't ever forget that good work and doing our jobs well is advertisement enough. So we get more referrals from having success stories. And actually, funnily enough, that's what one of the vets said. I wish I also received happy feedback, not just when there was a problem. So feedback about the patient is doing so well, we're discharging him, he's back at agility or whatever the case is. And he's like, it would be nice to hear success stories as well, because they generally only see the problem cases or when there's an issue.
That is such a good point because when are we, yeah, that is a very good point because even the client is not going back to their vet if their dog is doing well. You know, they're not going back to see them to say, yes, we're on the right track. You know, my dog is feeling great. They never hear that. They never see that. That's one of the reasons I'm glad I'm not a vet is because you don't get that side of the story. How demotivating must that be? So I like that. Some success stories with your vets. Make sure that when your patients are graduating from physio, that you send them an email and let them know and share the improvements that they've made in the time that they've been with you. And not just your concerns or when things are not going according to plan. That I think that's actually the biggest thing we can probably take away from this is, yeah, that one. Thank you.
I like to hear good news.
Yeah, they do.
Yeah.
Okay, so
and then yeah, I think so. Just another thing on that first question that we've gone off on a tangent, but there was actually a correlation between lack of referrals and self-reported poor understanding of vet physio and the cases that vet physios can see. So that's another thing that might affect referrals is if the vet actually doesn't understand when or who or why they would be referring to physio. And that does land with us, I think, from a practitioner point of view about educating what we can help with. I asked about case-specific types that they often refer, and we know the usual, your cruciate disease and post IBDD and those sorts of things, but we're missing patients that we can help, like our cardiorespiratory patients, a lot of our neurological patients, even wounds, obesity, performance type issues. So educating on the entire scope of practice that we can have an effect on. And that's why I think it's so important to understand your vet and the vets that you're working with, what their cases look like. So you can target their caseload and their specific case types.
So how do you recommend we go about educating vets that don't understand what we do?
I think it is a tricky one, and I don't think there's one answer. It's multifaceted. It does have to come at an undergraduate level from a vet point of view. So in terms of out of our hands, I do think more exposure to vet physios, which I do think is happening now. And I think it will continue to happen, will help to grow their understanding of where we fit into the multidisciplinary team. But I think our associations have a big responsibility to assist with campaigns and drives like they have been doing about what vet physios can help with. And then I think on the ground, the education, leaving leaflets or pamphlets, or if you have a lot of vet physios do this really well. You see a lot of it on social media, but having monthly information, choosing a specific case type and having information about how a vet physio can fit into the management of those sorts of patients. I think it's just repetition, and then feedback when you see a patient so that they understand, oh, well, this patient's being seen for pneumonia, for cardiorespiratory treatment. Oh, okay, cool. I'll send my next case there because it really helped. Obviously, with those cases, we need the vet to give us the go-ahead first. That goes without saying. But for for anything else, I think feedback to say what you're doing, how it's going to help them, will educate the vets in what we can do and where we can help.
Okay, yeah, I agree. It's such a tricky one because I do like the idea of, okay, you're face to face with the vet. So from the, on the ground level, you're face to face, you have that time with them. Of course, we want to be listening. That's one of the big keys of good communication, is listen to what they need. And you said like, what are the cases that they're seeing? And then how are you applicable to those cases? But I always struggle to bridge that. Okay, I'm listening to you and what you're doing, but I'm also going to tell you how I can help you. I'm so bad at that. Right?
No,
Yeah.
I think it's just results.
Yeah.
Because previous studies identified a lack of research in our profession as being a potential barrier for vet referrals, but it didn't so much come out in this research. They were very much more focused on does it actually work on the ground? So rather than getting that research base, yes, it's important. I'm not saying it's not important. It's definitely important. But just from the feedback I received from them, that they're more interested in their personal results that they're seeing with their clients. And I think that's on us in terms to make sure that we are 100% prepared for the profession, but that we keep ourselves up to date with CPD and with new things that come across. Yeah.
I would love to see some teaching that that kind of compares, that says, okay, well, if we have OA and we treat it with nutraceuticals, this is the improvement that we get. And if we have OA and we treat it with exercise, this is what we get. And if we combine that with massage, then this is what we get. And if we combine that with NSAIDs, then this is what we get. Like, I'd love to see this graph that compares all those things, and then to be able to put that in front of vets and say, like, let's combine your NSAIDs with my hydrotherapy, and then we'll have this, this much better impact, because they're not seeing those modalities and then how it can add. So I think that would be really, really great to have. Yeah.
I think that's the thing. The research has to be clinically applicable. So a lot of what we do, we base on human studies. I think the research base is growing a lot more in our animal physio treatments. But it's very hard to standardize a clinical study. OA of one stifle is not the same as OA of another stifle, so it's not going to necessarily respond or behave in exactly the same way. But yeah, if we can get that that research base up and show, I do think it will. I really do. But it has to be combined with on the ground results as well. So yeah.
Amy, thank you so much for sharing that with us. Are you publishing this research? Where will people be able to find it?
Yes, I am hopefully publishing. I'm busy with the write-up of the article currently. It's quite a process back and forth with my wonderful supervisors. But as soon as it's out, I'll let you know. I'm just selecting a few journals to approach, and then I'll let you know where you can find it.
Amazing. Thank you so much, Amy, and well done. Keep going. Don't stop.
Thank you.
Yeah. Look forward to reading the full article once it's published.
Thank you. I really appreciate the time. I love this topic. I could talk for hours on it.
Hours, right? We haven't even touched the surface.
No, we haven't. We haven't at all.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.